on a scale of 1 to 10, with 10 being the hardest, how would you rate OTA school?
Oh my gosh. Hi friends, it's Carly here. I'm so happy you're here. I have Emily with me today. She has a YouTube. I'll have it linked down below, and it is Emily Vidassi. She is switching from nursing to OTA. So we're gonna ask all the burning questions today. If you're new here, hi, I'm Carly. I'm so happy you're here. I'm an occupational therapy assistant. I work in a pediatric outpatient clinic. If you are interested in OT and learning about the practice, then please subscribe. And let's get right into the video. Okay, Emily, real talk.
Okay.
What is your burning question about OT?
Okay, well, I really want to know how you heard about it and how you got into it. When I was starting out trying to decide what I wanted my major to be in college, I knew nothing about OT, OTA.
I was actually in my sophomore year of college, and my aunt was like, do you know that there's an assistant to OT? I was like, oh my gosh, a 2-year program? Like, that is straight up my alley. So that's when I just started pursuing it and realized that it was perfect for my life.
I just recently heard about it when I was thinking about changing my major. I just didn't hear a ton of people talk about it. I didn't hear like a lot of experiences with it, but ever since like shadowing, everyone I've met has like absolutely loved their job. Like, can you kind of explain what exactly OTA is? Like, kind of the role of your job.
So I work in pediatrics, so I just work with kids all day. It's so fun. We get to play. You have to think about what the main occupation of a child is. So they're growing up, they're learning how to get dressed, they're learning how to do self-care, they are learning how to do school, they're learning how to have social interactions, they're learning what good behavior is. They're learning how to executive function, plan out their day. Basically, we're just teaching them how to live their life to the fullest, whatever that means for them. And we want them to have joy in their life, and if that means putting on their socks independently helps them out, that's what we're gonna work on. If that means learning how to have a conversation with somebody, that's what we're gonna work on. If that means adapting their home environment, if they're physically have some different abilities, then we're going to adapt that environment so it makes it easier on them. It also has a lot to do with caregiver education, because the caregiver is the ultimate person who's providing all of their care, obviously. And I always say, if there's no therapy at home, then therapy isn't getting done, because caregiver is the most important part in a pediatric clinic, really anywhere in OT, but especially in pediatrics, because a child's gonna learn some strategies, say they're learning some coping skills, but if their parent is not enforcing that at home, then it's not gonna carry over, and it's not actually going to help them.
Guys, let's talk about programs. Talk about your experience with it, getting in, applying, because I am applying today for OTA school.
Oh my gosh.
I know, I'm very excited. But I'm also like, there's still that fear and like nervousness that I won't get in.
Right. I have a video all about tips to make your application great for OTA school, so I'll link that down below, so go check that out. The program that I was in was 3 semesters long. In general, an OTA program is shorter. It's an associate's degree, so it's gonna be a year and a half type thing. Kind of how the setup looks is, at least for my program, we did the first semester, so the fall semester, was very heavy on lecture classes. We had mental health, we had foundations of occupational therapy, and then we had a couple fieldwork days just where you go out and observe, just like Emily's doing here today. She's just observing as we work. In our second semester, we did like one half was very heavy on lecture classes. Then we had our first 8-week field work, and that's where we went in and we were literally learning how to treat and like shadowing an OT the whole time. And then we had a couple online classes through that. In the summer semester, we had full field work. We were treating our own caseload, and we had one online class. Then at the very end, right before graduation, we came back to campus and we did our splinting class, which is where we learned all about how to split hands and the modalities that you can use. And then we had our NBCOT prep class, so we took a big old long test, and then we kind of got like the score that we could possibly have, since it was like a practice test.
after you finish school, there's a final exam to get certified, right?
Yeah.
Were you like nervous about that? Like, what was your experience with that? Because that's like the final thing you have to do before you can start your job, right?
Exactly. So you can treat if you are not certified, but you have to be licensed. I took a month off of school and of studying because I was just
exhausted.
I needed a mental break. A bunch of people took their test like immediately. And they were like, it's all fresh in my mind and I'm going to take it. But I knew that wouldn't be good for me. I knew my mind was not going to work like that. And so I took the month off, and then I didn't want to study. I forced myself to study, but I did not study as much as I should have. The main thing that I would suggest to people who are having trouble studying like I did would be to sit down and take the full practice NBCOT test and get that endurance of 4 hours. Because that was the hardest thing for me taking the test, was sitting there for 4 straight hours and not taking a break. Like by that 100th question, I was like, I want to go to sleep. I have a video all about the NBCOT, so that'll be linked below. Go check that out. It wasn't as difficult as I thought it was gonna be, but I second guessed myself a lot in the test. Like the questions would be pretty general, but the answers would be very similar. It'd be like one word was changed. But the most important thing about in school, in a clinical setting, in the test, is that you choose and implement the most safe, client-centered, and ethical thing. Like whatever that is, that answer, that treatment, if it's client-centered, ethical, and safe.
Do you think that the program prepared you for that? Or do you think it's more of preparing on your own after the schooling for that?
I definitely feel that the program did, obviously, because I mean I learned all the OT stuff through it. It wasn't just, okay, here's this diagnosis, what's the definition? It was, here's the scenario, and now what would you do in it? You had to take what you knew and apply it. So they're basically trying to see what type of practitioner are you going to be. You know, are you going to be safe and ethical and client-centered? Yes, it did prepare me, but I think the field work prepared me even more.
So the actual like experience of it helped a lot.
Definitely.
That's good. That like makes me feel better. Because I know nursing is very clinical based. Like you have to think clinically all the time.
For sure.
So I figured it was probably pretty similar in that way, just because you are still doing a lot of outside work as well. Everything is going to be hard in its own way, but on a scale of 1 to 10, with 10 being the hardest, how would you rate OTA school?
Oh my gosh. Coursework, I would say like 6, 7. First, it's going to depend on your learning style. And that's just up to you to make it work for yourself. But I would have to say coursework is on the lower end because it's something that you enjoy. And when you enjoy learning about something, you know, it's going to make it easier to keep going and keep, you know, endure through that. Stress, 10. I'm not exaggerating. Just because of how fast everything is. The caseload, the course load is very fast and very heavy, especially if you have a family, if you have a job, if you're commuting. You have to add on all those things to those long hours in class. You kind of are doing your schooling outside of the classroom. Like you're reading everything, you're studying everything, and then you come into class and you talk about it and apply it. So you have to really be on yourself about reading, and like if you learn by flashcards or if you learn by quizzing people, or when we were learning about muscles and things and nerves, and I wrote all over my arm, you know, to make it visual for myself. Really, it's gonna be what you make it, and
finding your learning style.
And just your situation as well. You know, what your daily life looks like.
That is probably similar for a lot of people in college. I think it's really important to find your learning style and just like the way you work and the way you learn, because I know it can be different from literally everyone in your class. I was looking at like the schedule for the program, and I was a little overwhelmed because it's a lot of hours. You're taking a lot of credit hours. So like that's nerve-wracking, but you think it's like doable? It's
for sure.
Very possible?
Yes,
okay.
definitely.
Because I know I'm like an overthinker. I definitely tend to worry a lot. Just for like everyone out there who is like thinking about going to OTA school or is who is in OTA school, what advice would you give them?
For people that are in OTA school, I would say prioritize self-care. I think if you're in it, then you know why you need to prioritize it, because you can just get bogged down in it. Oh, have I studied this enough? You know, that type of thing. And you just keep going, and you don't make time for yourself. Schedule self-care nights, give yourself a mental break, and it'll definitely help. Give yourself grace, because not everyone's perfect. Reach out to people to help you. Reach out to your professors, reach out to OTs in your community, ask all the questions, and don't feel ashamed about it. For people that are looking at OT as a possibility, shadow. Go observe everywhere that you can. Go do places you think you'll love, like Emily thinks she'll love peds. You know, go shadow geriatrics, go shadow in the hospital. Go shadow the places that you don't think you're gonna like. You know, if you don't think you'll like a hospital, still go look and see what OT looks like there, because it might surprise you.
Yeah.
Go shadow places that aren't clinical based as well, because OT is not just in a outpatient clinic or a nursing home or a hospital. I mean, you can be in offices, you can be in schools.
There's a lot more to it than I thought.
Oh,
like,
yeah.
When I started looking more into it, I started finding out a lot more information of like what you can do with it.
Yes.
So there's definitely like a ton of options for it. I think shadowing is really important for anything you do, like before you get started in that, just because it kind of confirms your decision in wanting to do that or study that.
Sure.
I've been like very pleased with like my shadowing experiences.
That is my number one suggestion for someone looking at OT, because you're not going to get any better like knowledge of it than just watching it and asking the questions. Ask all the questions. If you want to change lives, if you want to make a difference, this is the profession to go into, because I think Emily can attest, just by watching the past couple days, like we change lives. Like OT changes lives. The basis of it is helping people live their life to the fullest of their ability, whatever that means to them. How could you not want to do that? You know, how could you not want to bring a smile to somebody's face, or, you know, relieve stress of a parent from a kid who's having tantrums all the time? How could you not want to teach someone to put their socks on after a stroke? Like, it's just life-changing.
And I will say, so far, like from just shadowing and everything, the people that I've met and the experiences, everyone here is so happy. Everyone's just very happy to be able to help, and you can just tell like it's a genuine want. So I think that's very important. I think it does take a special person, but I think if it's something you want, then you should definitely pursue it. For me, from changing from nursing to OTA, the whole process has been very smooth. Most of my prereqs were all done. I had everything done, so I know that it is like a 5-semester program, but if you are switching from nursing, most likely you have all of your prereqs, so I only have 3 semesters left. That's which is really nice. So I think also if you're thinking about switching, it's a really good option. So far, I have not regretted my decision. I'm very excited to start school. Like, I'm really grateful to be able to be here and experience watching you. Carly is great at her job.
Thank you.
She is so good. Such like a sweet, genuine person, and the kids absolutely love her. It's been such a fun experience to be here. So I'm very excited.
OT is very broad, and so you can have it play to your interest. You know, it doesn't have to be that you're in a hospital in a clinical setting. You know, you can do art therapy, you can do mental health, you can do handwriting, there's so many different certifications and specialties that you can go into. Plus, you don't have to stop at OTA. You can also go on to OT if you want to. It's a really great stepping stone for that. If you get into it, you practice for a few years, and you're like, I think I could definitely do that OT's job.
Yeah.
You know, like I want to do more. I want to evaluate. I want to figure these kids out. If you're that investigative type, there's so many options with OTA.
I think that's all the questions
Yeah.
I have for you. I know it helped me a lot, so I'm sure it'll help a lot of you out there. If you're interested in OT or OTA, definitely check out like her channel. I think there's a lot of good, interesting videos on there that are very helpful. So thank you.
Yeah, of course. And
having
check out
me.
her channel. She's gonna have some new OT content coming soon, so you don't want to miss that. Now, you guys, remember, you are loved, your feelings are valid, and you deserve to take up space in this world. Bye.
Bye.